Welcome to KK Agrawal Med Talk. Today it's episode number 456 in collaboration with IJCP, Heart Care Foundation of India, and USV. I think this is one of the most popular medical talk show where the science is disseminated across the globe, and millions of followers are there who listen to the science. We have got a good series on very powerful and versatile antibiotic doxycycline. We have seen the versatility of doxycycline in respiratory tract infection, in skin or acne, in febrile conditions, in conditions like malaria or dengue. We have also analyzed in one of the episode how it is favored by WHO, the anti-inflammatory nature of doxycycline. And apart from that, I think gynecological infections, sexual transmitted diseases, and very important serious gynec infections like PID. So the series is ongoing. There is a very good response from all the audience. I welcome for KK Agrawal Med Talk Show. And very interesting is that today we have got a very prominent gynecologist from Bangalore, Dr. Aruna Muralidhar. She is a senior consultant and associate director for Fortis Lafame Sri Clinic in Bangalore. And I think in a very young age, she has been nominated for many awards. Rising Star Award, apart from that, Inspiring Gynecologist from South India. She's a star Rotarian. And she is popular among the patients because she writes a lot of blogs and newspapers, beautiful articles, and a lot of publications to her credit in terms of scientific research. And adolescent health, she focuses on, and even she is associated in the FOXY for Committee of Adolescent Health. So, welcome, Dr. Aruna. Welcome to
Thank
KK
you.
Agrawal
Thank you
Talk
very
Show.
much.
Yeah, yeah.
My pleasure indeed, and an honor to be here. Thank you.
Yeah. I think we'll start with the most important topic for today is gynecological infections. You are practicing at one of the most important metros. So, how do you feel that gynecological infections burden in the clinical settings?
Yeah, very relevant question. Thank you. So, in a gynecology clinic, if I just separate my obstetric patients and just go to gynecology, I think about 30% of my clinic patients are for infections of various kinds, whether it is just a simple candidiasis, a fungal infection, or a pelvic inflammatory disease or endometritis. So I would still say I think probably one third of my patients in the gynecology sort of section would be related to some infection or the other. This is what I would say. And
Yeah,
another important, yeah. So
yeah,
another important thing is when we talk about adolescents, we are seeing a very huge change in the lifestyle of adolescents, promiscuity, early, sexual sort of adventures, and multiple sexual partners, not uncommon. So these are the kind of women who need to be seen early rather than later in order to avoid problems in the future related to various health problems. Yes.
I think rightly you have mentioned about one of the point is that one of the risk factor for these infections is the adolescents. So that question I was about to ask you that during the whole gynecology aspect from the menarche to menopause, what are the different risk factors currently you think that where in spite of so many precautions taken,
Yeah.
the gynecological infection is still a burden?
Absolutely, absolutely. So, if they are completely innocuous, not very serious, for example, yeast infections, those yeast infections are likely to happen in anybody who has lesser immunity, for example, diabetics, and women with sort of poor hygiene, or women who have used antibiotics for some other reason. Even hypovitaminosis, that is low vitamin D levels, may cause cancer. Organisms. Am I audible? Sorry, yeah. Intracellular organisms or bacterial organisms, as you rightly said, a younger age, and women who have multiple sexual partners, those who have sexual promiscuity and not using, barriers such as condoms, past history of those, with past history of pelvic inflammatory disease, or any uterine procedures such as instrumentation, or even a termination of pregnancy done surgically, history of any sexually transmitted infections in the past, or even sort of an intrauterine device which may be put in. So all these are various reasons for infection. Also postpartum, when they delivered, especially if they've had an emergency cesarean section, they're more likely to develop an infection called endometritis, which is the infection of the womb, the inner layers of the womb. So these are the general risk factors that we tend to, ask for.
Yeah, I think the risk factors are multiple risk factors actually, and across the
Absolutely.
different age groups. Yeah, that is very
True,
important. You have
true.
mentioned. So I
And I
think
think
audience
another
has to.
important,
Yeah.
yes, just one more thing, sorry to interrupt. Because of the virtual thing, there's always interruption. Sorry about that. The human papilloma virus is another thing that I want to touch upon, especially if the condom is not used. Human papilloma virus, or HPV, is a sexually transmitted infection which actually poses a high risk for cervical cancer. And that is another infection that we need to, sort of watch out for and screen for. And these are the ladies who are more likely to develop cancer if they're smokers. So smoking is also one of the risk factors.
Oh, so I think a very interesting point is smoking is also risk factor. I think all the healthcare professionals also have to remember this particular fact. Now, one point you have talked about is like there is an increase in the adolescents' problems related to the infections. But now you are practicing in the urban settings. But if you look at the settings which are classical rural settings or semi-metros, do you think that the similar picture is there in these towns? Because you may be getting a lot of referred patients.
Absolutely. The problem is that it goes unnoticed. When I get, only when they go to a stage where they're infertile and they're not able to conceive, that's when we realize on examining further that they may have had an acute pelvic inflammatory disease which went unnoticed, which has blocked the tubes, etc. And even tuberculosis, for that matter, is very common in such settings. But promiscuity and sexual sort of, let's say domestic or intimate partner violence is everywhere. It is not only urban setting, maybe it is a little more, prevalent in terms of literacy and much of it is hidden actually. So it is not, they don't get spared, unfortunately. Yeah. It's there everywhere.
Yeah, I think you have mentioned about pelvic inflammatory disease. I think the vaginitis or cervicitis are relatively milder forms of infection. But I think pelvic
Yes,
inflammatory disease is one of the infection which is very, very important. So how serious is
absolutely.
this problem?
Yes. So pelvic inflammatory disease in layman terms is nothing but infection of the inner organs, that is the upper respiratory tract. So as we all know, the women have a uterus, they have a couple of tubes, they have the ovaries, and then the uterus is connected to the neck of the womb, and the neck of the womb is then sort of in the vagina, which is the birth canal. So, pelvic inflammatory disease can mean infection in the upper aspect of the reproductive tract, which means the uterus, the tubes, or in the tubal sort of what we call adnexa, in the side walls. So, this is pelvic inflammatory disease, and unfortunately, because of its the way it sort of presents, unless it's very serious, it may not get picked up, and many a times it goes unnoticed. And unfortunately, the problem with pelvic inflammatory disease is if it goes unnoticed or not treated appropriately, it may cause other issues, other problems. So I think all of us doctors have to be more vigilant for symptoms of pelvic inflammatory disease and treat it appropriately with the right antibiotics.
Since you have raised the question about that every the signs and symptoms are slightly different. So what are the warning signs? Because pelvic pain, as the name suggests, it is the inflammation.
Yes,
So
correct.
what are the warning signs where the clinician as well as the patient they should think that
Yes.
this is not a back pain problem, right? And it is something related to genital problem.
But we also have the uterus, the tubes, and we also have the intestine, the last part of the intestine, that is the rectum. and the large intestine lying there, and there is the bladder, the urinary bladder, and there are a lot of other structures like veins and arteries and all that. It's like a bowl down there, a pelvic bowl in which all these structures are there. But in pelvic inflammatory disease, if there is pelvic inflammation, it may usually sort of present as lower abdominal pain. Sometimes it may be associated with fever, depending on the severity. There may also be what we call dyspareunia or pain during sex. That is another issue. It may also present with, abnormal discharge, which can be of variety of let's say it can range from clear discharge to yellowish discharge to a little more greenish yellowish discharge with foul smell. So the abnormal discharge can be there, and sometimes it may not even have the odor. It may not have the odor associated. Just give me a minute, sorry.
So I think as Dr.
I'm
Aruna is
sorry.
talking about is that there are various warning symptoms which are very important, where all the audience as well as doctors have to know that there are some warning symptoms or signs you have to keep in mind, as Dr. Aruna was suggesting to us. Yeah,
Yes.
continue, Dr.
And you're right, Dr. Mahesh. Even the back pain, for that matter, back pain, sort of throbbing back pain also can be associated with pelvic inflammatory disease. And many a times it is just pushed away or attributed to some sort of, other musculoskeletal problem, etc. But if this pain is associated with certain features, I think it's very important for us to investigate and see whether we are missing out a pelvic inflammatory disease. Because anything to do with, say, bowel problems like irritable bowel syndrome, IBS, can also present similarly, or urinary bladder symptoms, for example UTIs or cystitis, interstitial cystitis. Even this can present in similar manner, or terminal ileitis, or even let's say any sort of intestinal infections may present in this way. So it is important for us to be able to pick up the symptoms and appropriately treat. So thorough examination is extremely important,
Yeah,
and
I think
getting the
all the
symptoms.
audience have to know that there are two PIDs. One is in orthopedics called as prolapsed intervertebral disc, and the most important in gynecology is the pelvic inflammatory disease. And the pain is one of the common factor in both, but there are so many symptoms, as Dr. Aruna has told us. What is important is
Yes,
that as you are telling that PID is slightly serious, so what kind of problems it can lead to, like infertility or any abnormalities, because which is more problematic
true.
for the people.
So an unknown. Yes. So, if unnoticed and untreated, pelvic inflammatory disease unfortunately can lead on to certain issues relating to the reproductive health of the lady. For example, it may cause a tubal blockage, which may lead on to infertility, subfertility, inability to conceive. It may also lead on to abnormal, locations of pregnancy. For example, the pregnancy, unfortunately, although the fertilization has taken place, the fertilized egg may just implant in the tube. So that's an ectopic pregnancy. Also, tubo-ovarian masses, where everything gets inflamed. So the tube and the ovary and all that form a big mass, which is full of sort of pus. So tubo-ovarian masses are another important complication of pelvic inflammatory disease, and it can go away and come back again. So there's something called acute PID. There's chronic PID as well. So the chronic PID means that it stays, the infection stays, and it keeps sort of repeating as acute episodes. So that's important to identify. Sometimes pelvic inflammatory disease can just continue to be there as chronic pelvic pain. So these ladies have issues with pain. It causes problems in their quality of life. They're unable to get it out of their heads. There's pain during sex, so even the relationships suffer. So I think these are all the problems relating to pelvic inflammatory disease, and sometimes it may even lead to more serious problems, such as for example, endometrial, the pus collection in endometrium in the uterus. So that's called pyometra, or it can even lead to sepsis. I mean, rarely, but sepsis is one of the issues with very very severe PID. So these are the
So I think Dr. Aruna has told us that the PID can be of acute nature as well as chronic nature. This is very, very important lesson that infection is not just acute, but in PID it may be chronic. And one more point she has told is that this infection can lead to some problems in the important organs in the female reproductive tract related to fallopian tubes or even uterus or ovary, or there may be pus collection at multiple places. It can affect the pregnancy and even the
Yeah,
sexual
yeah,
relationship, which is the quality of life. You can it can be hampered during this particular
absolutely.
infection.
A very rare problem, a complication is something called, where there are, there's a sort of subhepatic sort of adhesions and all that. So adhesions are a big problem, especially if somebody has had pelvic inflammatory disease which has gone unnoticed, untreated. When we have to do a surgery for some other reason, we tend to see a lot of adhesions where all the organs are stuck together. So it looks very much, completely packed up, like as if everything is clumped up together, and that's called a frozen pelvis. So that can be a big issue when we have to operate for some other reason. So that's another issue with that. Yes.
While discussion was ongoing, you talked about the antibiotic selection, and I think
Yes.
one or two because I think we will start with the organisms, because if I when I
Sure.
manage a respiratory tract infection or a GI infection, the organisms are different. So, what are the common
Correct.
bacteria which are related to the infections, related to the
Yeah.
female genitals? Yeah.
Sure, sure. So many a times, almost, nearly 70% of the times, they don't really pick up any bacteria. It could be just a sort of a completely unretrievable sort of problem there. But yes, in some situations, especially intracellular organisms like chlamydia and gonorrhea are very major culprits. Chlamydia and gonorrhea are both sexually transmitted, although gonorrhea can be a milder version. Chlamydia may be a sort of a more serious problem, but these are the main two things. There are also other organisms like trichomonas, things like mycoplasma hominis. There are even ureaplasma ureolyticum. There's another condition called bacterial vaginosis, where there's no particular bacteria present, but the pH varies. So the vagina is a self-cleaning tract. The birth canal is a self-cleaning tract which has its own set of bacteria which keep it acidic in pH. So the pH of vagina is always acidic to keep it healthy. And that is because of the normal flora or normal bacteria present in the vagina. So when there is a change in that flora and the pH changes, the pH becomes more alkaline, that is called bacterial vaginosis. And that is because of some sort of vaginal dysbiosis, imbalance in the normal flora. And that typically presents as a very fishy odor. The discharge may be clear, but it's very fishy in odor. And this typically also can happen just after a period of makes the pH alkaline, and that typically gives a fishy odor. Although it's not a very serious problem, it is very let's say uncomfortable for the lady, and the odor can be a big issue. But other than the bacterial vaginosis, as I said, chlamydia, gonorrhea, hominis, mycoplasma hominis, ureaplasma ureolyticum are all other sort of bacteria. Sometimes it can be polymicrobial. For example, these may not be there or may be there, but it's also associated with E. coli or pseudomonas or klebsiella, etc., which are typically seen in the bowel, in the stools, and also cause urinary infections, but they may also cause vaginitis. So these are all the this is a spectrum of bacteria. And of course, rarely we do see tubercular PID as well, where there is mycoplasma, tubercular bacilli, which are sort of but for that, we have to do a specific sort of culture and a specific sort of test called gene expert, because tuberculosis is not very easily picked up. So we have to take a sample of the lining of the womb and then check it for tubercular bacilli.
So I think Dr. Aruna has clear-cut mentioned that there are multiple organisms which are involved in the infections. Gram-negative is one, atypical, anaerobes, and as well as she has mentioned that the normal flora get disturbed, and because of that also there is a chance of infection, which is very, very important. So while selection of antibiotic, especially PID kind of a disease, you may be requiring 2 or 3 antibiotics, right? So, and
True,
I think
true.
yeah. So, what is the common selection and what is the role of doxycycline in your practice?
Yeah, doxycycline has a very big role, to be honest. So many a times when I would say when a patient is presenting with in order to avoid a pelvic inflammatory disease or in order to avoid an infection. Many a times we also check, especially I do what we call endocervical swabs for STI screening and specifically send it out for chlamydia, gonorrhea, and other sexually transmitted infections. Sometimes I combine the swabs with HPV also, that is human papillomavirus. But if you're not able to do them, I think it's always important to empirically treat women who are coming for, say, PID or even termination of pregnancy with a course of doxycycline and metronidazole. And in such situations, empirically, I use doxycycline 100 milligrams twice a day for 7 days and metronidazole 400 milligrams twice a day for 7 days. So this is my general sort of regimen that I use, right? Also, of course, there is a role of giving a single dose of azithromycin in certain situations. So it depends on what exactly is the reason why we're starting. It can also depend. It also depends on the kind of bacteria that we isolate, and also the kind of symptoms, and typically. Where is the infection likely to be? So depending on that, we change the antibiotic regimen.
Yeah, I think and doxycycline remains one of the very important antibiotic in the gynecological infections. One of the reason is like really
Absolutely.
broad spectrum in the characteristic, not only gram negative but even the chlamydial infection, atypical infection, rickettsial infection. So many different organisms which are covered. And
Yes.
regarding the duration, you have talked about like 7 days therapy of doxy and metronidazole. But in a certain PID, do you recommend antibiotics for 2 weeks or 3 weeks if it is
Oh,
required?
yes. Yes, yes, absolutely. So, as I said, yeah, you're right about doxycycline having a very, major role to play in gynecological infections. I think depending on the isolated organism, for example, if it is a definite chlamydia, gonorrhea, and all that, or there is salpingitis, then we may have to give her a longer course of doxycycline. And sometimes, yes, I do extend it to about two weeks. Probably not to 3 weeks so far, but yes, up to 2 weeks I have given it. But if it's empirical, it's just 1 week, 1 week of doxycycline.
The another important point about antibiotics is the patterns are changing nowadays because of the resistance that you
Yeah,
are practicing for. So, like for 5 years, there are some antibiotics and some organisms. Then the pattern changes, right?
correct.
Yeah.
Absolutely. So, as I said, empirical treatment to a large extent. Even if we do empirical treatment, I would encourage everybody to take a swab, like a culture swab, before treating, so that by the end of 3 days, by the end of 72 hours, if we have a culture, then we can sort of change our antibiotics accordingly. And that's very important because many a times what happens is, I know it is polymicrobial, and many gynecologists or even others, physicians, they may give a combination therapy. For example, they give clotrimazole, azithromycin, and fosfomycin, things like that. A combination therapy, fluconazole. So this generally is given because antifungal is there, anaerobic cover is there, and also an antibiotic is there. But preferably, it would be ideal to sort of isolate the organism, find out what exactly is the cause, and treat accordingly, rather than not taking the swab and just empirically treating them, because then we may not be able to isolate what the problem is, what is the sensitivity of that bacteria, the organism, and which antibiotics can work, and for how long to use it. For example, if there's a very heavy growth of E. coli and that is sensitive to only certain type of antibiotics, it would be better to use that antibiotic, according to the culture, or change the antibiotic when the culture report comes and take it for up to 7 to 14 days. That would be a better way to deal with it. Also, STI screening is very much available. In fact, from Bangalore, it goes from our SRL lab, it goes all the way to Mumbai. It reaches you, and there it is reported. But luckily, we have some labs where we can, sort of outsource the samples, where they give the report within 2-3 days, and they give us all the bacteria isolated and the sensitivities as well. So I think that makes sense, and I think everybody should be able to do STI screening for their patients.
It's very important point you have emphasized that the screening and the diagnostic of culture sensitivity is important for if it is a persistent infection or recurrent infection where the organism is not getting picked up. Another important point about doxycycline is that it is one of the antibiotic is which has got an anti-inflammatory action, and this is a pelvic inflammatory disease where there is inflammation, there is swelling, there is pain, loss of function, all those factors. And very few antibiotics have got anti-inflammatory action. So I think doxycycline has got a dual benefit here as an antibiotic and as an anti-inflammatory.
That's right. That's right. No, I definitely see a huge change when they use doxycycline. I mean, the response is, very, very immediate and very, sort of, they feel immediate relief with doxycycline and the combination therapy. No doubt about that. I don't think we can do without it.
I think one of the point you have shared is that you are on the Foxy Committee of Adolescent Health and you are running a STI. So I think you have to really tell the audience about the STIs. What is the pattern? Are they changing, or is there any new things which are happening in the STI
Sure.
field?
Certainly, yeah. So you're right, Doctor Mahesh. In the sense, I do have adolescent clinic. So I run adolescent clinics about all the aspects of adolescent health. For example, I mean that is only one part of my practice. I do obstetrics and gynecology also, but when I do adolescent clinics, I see the parents and the adolescents separately and together also, in a very friendly, approachable manner. That's very important. Adolescents should not get put off, because those are 9 to 19-year-olds who are not adults, who are not children. So these are very, sensitive group of people who think they are very healthy, they have no issues, or they may land up in a very huge problem and then come to me. For example, an unwanted pregnancy or some sort of STI which is causing trouble. So in any case, when I see them, you rightly said, I go through the entire history, including sexual history, menstrual history, what we call HEDS assessment, where home, environment, social life, spirituality, also mental health, very important. Mental health, everything is assessed, and then I examine them. Obviously, if they've not been sexually active, that's a different matter. But if they've been sexually active, I always do the internal examination and swab to rule out an infection. So I think STI screening, as you rightly said, is a very important part of adolescent health clinic. When I trained in the UK, we used to have genitourinary medicine clinics. They were very discreet, confidential clinics. There was no board saying genitourinary medicine clinics. So these were advertised on toilet doors, for example, inside the toilet, behind the door, they were advertised. So if you have trouble, please visit us, in this set of locality. So the young girls would feel more, sort of confident, and they would be the information would be kept confidential. So they had that confidence that they could go there, and they would come, and then we would talk to them about all the, and when we do all these tests are immediately done. We treat them accordingly, and then do something called contact tracing. When we say contact tracing, we have to be able to trace all the contacts, sexual contacts that she's had, and treat them also, because these are the people who will spread it to others. Or if she is treated and the guy is not treated, then it might come back to her. So it's important to trace the contacts and treat all of them in a very discreet and confidential manner, in a very empathetic manner, because only then will her long term reproductive life be safer. Otherwise, she is more likely to have issues with complete infertility or subfertility, ectopic pregnancies, unwanted pregnancies, or even pelvic inflammatory disease related long term complications. So I think as a society as a whole, we should be able to encourage more and more adolescent health clinics and STI clinics as part of it.
I think
That's
this is
that's what
very,
I'd
very
like to say.
important. Yeah, the adolescent, because the India is now a hub of young people, and the lack of education in this particular aspect throughout the whole
Yes.
our education during the schooling as well as college, and this
True. True.
mishaps can happen, and the taking care. So one of the point you have mentioned about partners as well as tracing them, and so do you give some antibiotic course to the partners also if
Yes,
you know?
yes, absolutely. And I think, see, although they may not come forward for a thorough examination, because even those would require urethral swabs. Ideally, we should be able to do urethral swabs, but they may not come forward. And many a times, barrier contraception, as we know, barriers in the sense of condoms can prevent sexually transmitted infections. But many a times, youngsters don't bother to use them, or there may be condom breaks, etc. But if the partner is detected, the contacts are traced, and they are also given a similar course. So they are also given a doxy and metrogel course. Works very well. Even for let's say, when we do semen analysis and we find certain pus cells, etc. Even then, we give them either a course of cephalosporins or a doxymetrogel course in such situations, because but the men may not have any symptoms at all. It may be picked up only on swabs. But if they have had any contact with a lady who's been diagnosed to have chlamydia, it's important and it's a responsibility of the lady to be able to tell the contacts so that even they are treated appropriately. And this is an issue which is always a bit of a difficulty for us, because
Yeah.
they may not come forth with with the information. But what I do is I give the prescriptions out, make sure that either they see the urologist or a andrologist or even a dermatologist with STI expertise, or I give the prescription and say if there are no allergies, he might have this course, because at least that way something gets done.
So I think very important new mantra you have given today is about adolescent health and the STIs which are focusing towards adolescent health, which is related to the genital infections or the other problems which are going to be there. I think very good discussion and dialogue today. It's very free and open. Any small message you want to give in the last to all the viewers, basically from healthcare professionals?
Sure, certainly. I request all of you to take a thorough history, because most of the times we get the answer from the history. And also, please don't hesitate to ask about sexual history. That should be a part of your thing. You will be surprised how many of them have had, even if they're like 20s, early 20s, not married. You'd be surprised if you have a good rapport, they will come out with information about sexual history. And I mean, it's almost become very uncommon for people to not have had sex before marriage. Unfortunately, it's as common as that. So please be forthright. I mean, forthright with the history of sexual contact, and also kindly treat them empathetically and with a lot of in a sensitive and approachable and friendly manner. And please do not hesitate to treat them empirically if you have any doubt of a possibility of PID or STI.
Thank you very much, Dr. Aruna. I think great message about
Thank you.
the gynecology infections, as well as there is an increase in the adolescent health-related problems and your passion towards managing them. And Dr. Aruna has given us a great mantra of doxymetro combination for acute as well as chronic infections which are related to the gynecology. So all will practice that in a thorough manner, but taking a good history, identifying the organism if it is with doing a culture, and appropriate selection of antibiotics, it will be very very critical. Thank you very much. Thanks a lot on KK Agrawal
Thank
show,
you.
that is episode 456 in collaboration with IJCP, Art Care Foundation of India, and USP. Happy Dasera to all. Sarve Sukhinas Santu, Sarve Santu Niramaya, Sarve Badrani Pashtantu, Ma Kashid Dukkhamap.
Thank you very much. Happy Dashera to all of you. And please do not indulge in too many sweets. If you are eating a sweet, please run or walk so that you can burn those calories. Thank you very much. Thank you.
Thank you.
Namaste.